from Barcelona, Spain, and I work into the University Hospital German Trias, Pujol. I will present our work relative to the management of institutionalized individuals in Catalonia during COVID pandemic through a health application named COVIDApp. Excuse me. Okay. As everybody knows, the public health crisis generated by COVID required the new care and management approach, especially in older individuals, because the pandemic has a high impact in older individuals and their residents or long-term care facilities. The complexity for pandemic control has done that the social and health systems were facing a great challenge. For that, need to provide an integrated response to the healthcare emergency. Is necessary or was necessary innovate tools or creative innovate tools as a COVIDApp. COVIDApp is a platform for the management of COVID institutionalized persons in long-term care facilities for controlling the epidemic in this setting. Given this scenario, we adapted a platform, the name is COVIDApp, and the objective of the aims is the address of current COVID crisis by closely monitoring of institutionalized subjects and their contact through the early detection and self-isolation of suspect COVID cases, the rapid development of epidemiological action, minimizing the risk of transmission in these residents, the remote treatment and monitoring of new cases of COVID when it was indicated, and the knowledge of the progression of the infection in real time. In this work, we describe the use of COVIDApp for the management of COVID institutionalized persons procedent from nursing homes and or institutions for people with physical and mental disabilities. The data report in this work was registered in the platform between the 1st to the 13th April of 2020. For this was necessary the creative of multidisciplinary team because this team have to configure and implement a strategic line in prevention, diagnosis, and management. Two was necessary the adaptation tools as a protocol, information, communication, all through the platform COVIDApp. Health workers agreed decisions, and the implement of decisions was mere learning by doing methods. The operational alliance was necessary, an integrated response were obtained of professionals of these residents, the primary care team, other supplies, and institutions. The COVID training was made to all healthcare professionals of the primary care center and the residents, and the parameters enforced daily by the healthcare staff were the following: number of persons with signs or symptoms of COVID, number of persons with diagnosis of SARS-CoV by PCR, number of residents that remain asymptomatic for more than 14 days, number of deaths, healthcare worker isolated, will be confirmed cases, suspected cases, or contacts, and the number of residents at risk. The primary care center was the she had to make the monitoring of parameters, decide, and implement interventions in early stage. Other data as the status of a primary care center and the resident in real time will be to abort that COVIDApp platform. Excuse me. Okay. The steps for the function of the platform were as follows. First, the healthcare personnel or professionals report the signs or symptoms for all population that live in these nurse homes or this institutional for persons in this institution. Okay, she there detect a suspect case or contact case, and we detect this case. An alert was sent to the primary care team. The primary care team initial the clinical assessment that was planned the first 12 or 20 hours and initiated the preventive epidemiological recommendation for compartmentalization, the specific area, isolation of suspected cases and content, and to make a PCR testing that the results we have in the first 20 hours. If this PCR testing is positive, we continue the isolate and the quarantine. We install the appropriate treatment and monitor the patient twice a day. If it's negative, if PCR is negative, we stop isolate. It is important that the monitoring of the patient twice a day, we can select the patient that if is a mild case or a severe case. The mild case receives sport treatment and severe case is transferred to the hospital. If we have a patient with end of life, they receive a palliative care in the center or go to the hospital. For that, we say that we learn by doing, because the qualitative data was collected by the health work, the quantitative data were saved in COVIDApp platform, and with this data, we can identify people in high risk. The result is that we can install the epidemiologic action weekly. COVIDApp improved the communication between the primary care team and the long-term care facility for three steps. First, the early attention with the daily report and early detection of suspect and confirmed case. The monitoring clinical values, the real-time monitoring and the PCR results. And after that, we can take a clinical decision that was important to preserve and stop the spread of the virus in this residence. Our result after 13 days of follow-up using the platform, we had managed the data from more than 10,000 institutionalized individuals and more than 4,000 of field work. The information was scattered for more than 2 residents, 1,169 nursing homes, and information processed of 27 institutions for physical or mental disability. In this circuit participate 64 primary care centers. This primary care center processed of the north area of Barcelona that have a reference population of almost 2 million of inhabitants. The first figure report the number of confirmed or suspected cases reported in this population during the time of the study. We can look that the confirmed case that is blue increased on the first week and remained stable the last 2 weeks. But relative to the suspect or symptomatic case is a orange line. We can look that this have a rapid increase of suspect cases and after remain stable during the second week and decrease during the 2 last week. Around the 50% of the residents remain asymptomatic more than 14 days. In reference to the deaths, deaths show an increase during the first 2 weeks, and how you can do is allow deaths show an increase during the 2 first weeks, followed a progressive decrease thereafter. A total of 8% of deaths were reported in this population, and 44% in a possible suspect or confirmed case of COVID. The number of isolated health worker is the blue line. You can look that remained or stable over the 30 days, and suspect cases decreased during the last 2 weeks. The number of residents in high risk decreased of 10% until 0.5%. In conclusion, this pandemic has highlighted the need to optimize existing records to prevent the collapse of the health system. COVIDapp could help the clinician to rapidly detect and remotely monitoring of suspect or confirmed cases of COVID, thus limiting the risk of spreading the virus. Rapid development of epidemiological action are necessary, and the COVIDapp led us remote management of new COVID cases treated in institutions. To improve the communication and coordination between primary care center and the resident health care worker, and show the characteristic and let's show the characteristic and progression of the situation in real time. COVIDapp can help us design new strategies tailored to a specific setting.